Hello again, and welcome back to the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and in this video C1, we're going to cover something absolutely critical, the legal and regulatory landscape around offering IV chelation therapy in your medical practice. Before we begin, here's our standard disclaimer. This video is for educational purposes only and does not constitute legal advice. Always consult your healthcare attorney, state medical board, or regulatory agency before offering any new service in your clinic. Now let's dive into the three essential pillars of legal compliance in IV chelation: scope of practice, product regulation, and proper documentation. The first question you must answer is, are you legally allowed to perform IV chelation in your state, province, or country? In the United States, only licensed medical professionals such as MDs, DOs, NPs, and PAs working under supervision can legally administer IV chelation. RNs and IV certified nurses may assist in the infusion process under a physician's order, but diagnosis and prescribing fall under the physician or advanced practice provider's role. Outside the US, check with your country's medical council or health authority to understand who can prescribe and who can administer chelators. Also, check your malpractice insurance. Make sure chelation therapy is a covered service. Once you've confirmed you're practicing within your legal scope, the next step is understanding how chelation products are regulated, especially by the FDA in the US and the EMA in Europe. Let's break it down. FDA, US. The FDA allows the use of chelating agents like calcium disodium, EDTA, deferoxamine, demercaprol, and DMSA for specific approved indications, such as lead poisoning or iron overload. However, the FDA has issued warnings against unapproved chelation products marketed online for detox, autism, or anti-aging without proper evidence. Only pharmacy-compounded chelators made in USP 797 compliant sterile facilities should be used. EMA, European Medicines Agency. Similar to the FDA, the EMA permits chelators with approved medical indications. Off-label use may be permitted under a physician's discretion, but proper documentation and informed consent are essential. Bottom line, use only approved medications sourced from licensed pharmacies and ensure the indication is medically justified. That brings us to our final and perhaps most protective legal measure, informed consent and documentation. For every patient undergoing IV chelation, you must obtain documented informed consent. Here's what that includes: explanation of the treatment, what chelation is, why it's being used, and how it works. Risks and benefits. Discuss side effects like hypocalcemia, kidney stress, or allergic reactions. Alternatives. Let the patient know other treatments are available, including no treatment. Patient understanding. Always allow the patient to ask questions and give them time to decide. Pro tip: have a written consent form specific to IV chelation therapy that includes the agent name, purpose, frequency, and any off-label use disclosures. To recap, ensure you're operating within your licensed scope of practice. Only use FDA or EMA-approved chelating agents and source them from licensed sterile pharmacies. Document everything, especially informed consent. If you're ever in doubt, talk to a medical attorney or your state board before moving forward. It's not just about protecting yourself, it's about protecting your patients and your practice. In video C2, we'll walk through how to actually set up a chelation service in your clinic, including logistics, staffing, and workflow. Thanks for watching video C1 of the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and I'll see you in the next video.